So what is COVID-19? COVID-19 is a respiratory illness caused by a newly discovered virus called coronavirus, or SARS-CoV-2. What are the symptoms to look out for? A new continuous cough. This means coughing a lot for more than an hour, or 3 or more coughing episodes in one day. A high temperature, where you feel hot to touch on your chest or back. And difficulty breathing. So what should you do if you have symptoms? Contact your healthcare provider and follow their directions. They will be able to provide you with up-to-date information and advice. Self-isolate yourself at home for 7 days whilst you recover. If you live with more than one person, you must all isolate for 14 days from when the first person in your home began experiencing symptoms. What precautions do we all need to take? Keep good respiratory hygiene by only coughing or sneezing into a tissue and throwing away your tissues immediately after use. Cough or sneeze into the inside of your elbow if you don't have a tissue. Maintain social distancing by keeping a distance of 1 meter or 3 feet between yourself and anyone you need to meet, and avoid physical contact. Regularly wash your hands, and each time do so thoroughly for 20 seconds. If soap is unavailable, use an alcohol-based hand sanitizer. Refrain from touching your eyes, nose and mouth. Follow these guidelines and keep up to date through your healthcare provider, and you'll be doing your part to help slow the spread of the coronavirus.